I get a lot of questions about hyperpigmentation on the face, and especially people talking about how they notice that their face is darker than their body, which is something that I deal with. For some people, part of it is genetic, but most of the time, the reason why your face is going to be darker than your body is because of overexposure to UV rays and UV damage. So you're developing hyperpigmentation, age spots because you haven't been wearing sunscreen. I personally can attest to this because for the first 31 years of my life, I did not wear sunscreen. I didn't know about it. I just didn't know anything about skincare. All I did was wash my face with regular lotion, wash my face with regular face wash, and then I would just put a moisturizer on. But I was not really privy to the importance of wearing sunscreen until I actually got into aesthetics and started understanding aesthetics and the role that UV rays had on the skin. So now I am very diligent about sunscreen. I personally will say that use the sunscreen that works for you. A lot of people say use mineral sunscreens, and they are great, but I just find that I am not very drawn to them because I don't wear makeup. Typically, I don't know how to, and I don't want something that's, something that's going to give me too much work. So I prefer to stick with the chemical sunscreens because I put them on. I'm using Innisfree right now, but I put it on and you know, it looks good. I don't have to worry about adding an extra layer of makeup on, and you know, we're good. So yeah, that's basically what I want to say. So I want to say that if you have hyperpigmentation on your face, or if you have dark spots that are getting worse, then you need to be diligent with your sunscreen. And then once you become more diligent with it, you will start to see improvements. And once you're really good about using sunscreen, then you can go ahead and say, all right, I want to start using products that are going to help with hyperpigmentation. So ingredients that have kojic acid or alpha-albumin, or maybe even using some hydroquinone if it's prescribed by your physician. And then using brightening agents like vitamin C, glycolic, lactic acid, things like that. But until you are diligent with sunscreen, you're not going to see the improvement in your skin that you want to see. And personally, my skin is still not where it needs to be, but I'm getting there. So I hope that was helpful.